This is another one. 3-month-old ankle sprain, came from Southern Illinois, was weight bearing on it, walking, and it just was swollen and extremely painful. And if you look at that, nothing really looks that wrong. There's no fracture, there's no dislocation. He's heavy and he's diabetic, but he says something is wrong. I told him, I think you have Charcot. That was my only thought. I put him in a cast non-weight bearing, and I'm telling you, I didn't realize what was wrong either. This is not Charcot. It didn't look like Charcot. His swelling went down. I'm like, I don't understand what your problem is. But I said, hey, I got this new device. Get on the CT. And then I got the CT, and that's what I saw. That's that same x-ray you just saw. He had a Chopard injury that went terrible because he was weight bearing on it. He's diabetic. He had a medial talonavicular subluxation. If you look there on the axial, the CC joint's in 60 degrees of varus. So unfortunately, this guy should never have been walking on his ankle. He should have been non-weight bearing, casted, and maybe it would have done okay. But now you understand the problem, where before, I don't know if his ankle, maybe I would have done a brostrum. I didn't understand. He needs a triple. So that's what we did. He needs a triple. He has subluxations and diabetics. Without the weight-bearing CT, and maybe I'm not a good clinician, but I could not understand what his problem was. And the other best part is he got lymphedema post-op, so you don't know if you're going to let this guy weight bear. So 3 months post-op, you get the weight-bearing CT again, and a couple of things. You can see the reduction of the deformity is, I think, pretty good. And you can see there's actual bony union across that 3 months in a heavy diabetic. So I can let him walk with confidence without any concerns that this is going to fall apart and now give me a problem. Because otherwise you're using an x-ray that you can't tell if it's healed or not. And if you weight bears and it's not healed, you're going to get a Charcot or a dislocation of what you had before. And at 3 months, you can see solid union of that subtalar joint. And you can see the screw, and I can still see my fusion. And you can't see that on a regular CT. He's 6 months out. He's weight bearing in a gym shoe. He's doing fine. He's not going to run a marathon, but that's the benefit of the weight bearing CT.